After weeks of closed-door meetings and criticism from Democrats and Republicans, including Governor John Hickenlooper on CNN, GOP U.S. Senate leaders released its version of health care reform legislation on Thursday. Among many changes, the Better Care Reconciliation Act of 2017, which likely would need a little better title to roll off the tongue, would completely phase out the Medicaid expansion after 4 years, defund Planned Parenthood, and establish a $2 billion fund to fight our nation's opioid addiction crisis. Natasha, this is far from over. This is actually just the kickoff. But if Mitch McConnell gets his way, it would be done by the July 4th holiday. Do you think there's any shot of that vote happening between now and July 4th?
I don't think it's a good thing for the American public if it happens that quickly. I think we need some more debate about what's going on here. As you said, it needs a better name, and I think the better name will be Trump Care, just like the Affordable Care Act became Obamacare before it. There's so many things to be concerned about in this bill, and I think we'll spend a lot of time in the next few days hearing more about what some of those specific concerns are. In Colorado, Cory Gardner has already said that he wants to look more at the Medicaid issue and to look at particularly how we're funding care for kids with disabilities and kids with sort of very extreme or complicated medical cases. That seems like a no-brainer to me. But there's a lot of things in this bill that I thought were no-brainers and then now are going to get pulled back for the American people. One of the things that still dismays me, not just with this particular issue, but politics in general, is that people could run on an issue, say we're going to repeal this, but have no actual plan for what was going to go forward. So then we go through the circus that we've had in the last few months and a closed door session to draft something together in what feels like a haphazard way. At what point are we going to hold our politicians accountable for that? That you can't just say that something's wrong. Let's come up with actual solutions to fix it. And yes, I guess so now they have that solution. I just would also say to people that if there's a vote on this, I think there's going to be some Republicans that hold out that say, okay, we want this little takeaway here, I need this to make my constituents happy. At the end of the day, a yes vote is truly a yes vote. It's not a yes with some footnotes. It's not a yes but reluctantly. It is truly a yes vote saying that this should become something that is law in our country. And yeah, so it's time for people, if they have a problem with it, get on the phone with their senators, but they should also call their insurance companies. They should call their employers. They should talk to their state house representatives. This is an issue that is going to be in the news on probably a daily basis for many more months.
David, I heard a great quote this week, a politician saying that arguing or debating a bill like this behind closed doors without getting public input, without doing it in the public forum, was not only partisan but a recipe for disaster. And it was Mitch McConnell from 2010 talking about what the Democrats did. If the Republicans are going to replay the strategy that was criticized and eventually led to them losing the Senate in 2010, are they writing their own recipe for disaster?
Well, right. The Democrats lost 63 House seats in 2010, probably half of those because of Obamacare and half just because of other political reasons. Sure. It's tough for people to know who to trust in this kind of situation. I think most people in the audience, like me, have not yet read this 142-page bill. I think Senator Gardner's right to say it should be slowed down. So it's one thing to draft a bill behind closed doors, but then whatever you negotiate and produce, that should be out for the public long enough for there to be public discussion. When you try to figure out what's going on, you should consider the credibility of the source. So don't treat as credible the sources like Barack Obama, who told you in 2009 and 2010 that under his plan you could keep your doctor. If you like your insurance, you could keep it. That your premiums were going to go down $2,500. The opposite of that happened to tens of millions of people, and now people are stuck with the death panel of Obamacare. As it turns out, it wasn't hidden in one little place. It was the thing as a whole. It's a death panel for itself. It's on the road to financial collapse. It's unsustainable. It was created with accounting tricks and fraud, which if the federal government were traded on the New York Stock Exchange, would send everybody responsible for it to prison for fraud.
But if President Obama was wrong in 2009 and 10, are everybody that's telling us that it's going to be better now also wrong?
Well, they probably yes. And so what I trust is I'm affiliated with the Cato Institute in D.C. They were the ones who called out the accounting lies and tricks and obvious unsustainability on Obamacare immediately. And they're saying this thing, more of the same. Rearranges some of the deck chairs, has some different things about it, but does nothing to solve the fundamental problem that this federal hyper-controlled system of health care is going down. If you don't change it, it's going to go down, and if you do these changes, it's still going to go down.
Penn, you have a long career as an attorney, but also you held a long esteemed career as a lawmaker. Now, as a state lawmaker, not a United States Senate, but I would believe that you would understand the strategy of sometimes doing things behind closed doors, or sometimes faster than others might think they want to do it, or slowing it down to be more public. When you look at this strategy, seeing what happened to Democrats in 2010 and seeing what Republicans are doing now, what do you make of the strategy?
The strategy is consistent with the ultimate objective. Let's be clear. This bill has nothing to do with health care. This is tax reform phase 1. It is masquerading as a health care policy debate, but the reason you don't hear much debate about the policy is that's not really what's driving this. The Affordable Care Act was funded in part by an income tax, increased taxes on people earning over $200,000, investment income, indoor tanning salons, prescription drugs, and medical devices. This Senate bill repeals all of those tax increases and even gives a retroactive tax cut on capital gains. This debate is not primarily about health care. The problem is health care has become the surrogate for Mitch McConnell and his friends' desires to provide tax relief to the richest 1% in the country. Don't get me wrong, it's their prerogative as leadership. That's what they care about and that's what they want to do, but they're not being transparent about it. And the problem is a whole lot of people are going to get hurt in terms of, and the Affordable Care Act wasn't perfect. I think we all agree with that. And it was never intended to be perfect or permanent. It was a start at something. So the question you have to ask to channel Ronald Reagan is, will you be better off in 4 months than you were 4 months ago? And the answer invariably when it comes to health care is no, because the House version and the Senate version are disasters. In terms of McConnell's strategy, if your real objective is tax policy change, you almost don't care if this bill passes because you're going to do another tax policy bill right behind this. So his idea of writing it in secret, dumping it on the table, he either gets votes for it or he doesn't, but he at least can say, we put forward a bill, we tried to repeal Obamacare, either we do it or we don't, and we just move on, and now let's talk about tax policy.
Noel, you and your colleagues at the Denver Post are going to be covering politicians like not only Governor Hickenlooper, but Cory Gardner, who were making national headlines throughout this week about this topic. They changed over the week. We were talking about Senator Gardner not being able to see the bill yet, but then that changed as soon as the bill dropped. Governor Hickenlooper is on with John Kasich on CNN, and the story changes once, again, the bill comes out. How do you think both these Colorado elected leaders look at the situation and how they're ultimately going to react, both Governor Hickenlooper on the state side and how Cory Gardner is going to vote in this one? Right now, he's formally on the fence.
Right. Well, our Washington correspondent, Mark Matthews, reported yesterday, and it was in today's paper, Gardner, who's part of Republican leadership, has hinted that he is not ready to vote for this. McConnell can't afford to lose Gardner and even one more senator. So it'll be interesting to see if they stand up to the boss, Mitch McConnell. Hickenlooper, this may be a chance for him to raise his profile in national Democratic politics. I think both of these guys are going to be vocal and going to be seen, and we're going to hear a lot from them. Our politics team is going to be really busy in the coming weeks as this gets hashed out.